Alright, so we're going to start off with inspection of the skin symmetry and checking for pulsations and any peristalsis that's happening, and looking for any bulges, masses, hernias, and then checking for scars from previous surgeries or striae. And then we're going to start with auscultation first, which is different from all other physical exam systems. You want to auscultate first on the abdomen, and I'm going to start with the diaphragm of the stethoscope starting in the right upper quadrant, move into the left upper quadrant, go into right lower quadrant, and left lower quadrant. Listening for bowel sounds, making sure that they're present. If they're not present, could indicate an obstruction. And then we're going to flip over using the bell of the stethoscope, listening for bruit in each section of the abdomen again, right upper, lower, and then listening for aortic bruit and any renal bruit, and the iliac and femoral arteries, which would be down in this area. Checking for, and if bruit is present, it could possibly indicate aneurysm or arterial disease or carcinoma. So now we're going to percuss in all four quadrants. So when I'm percussing, using my strong hand and percussing each quadrant, just like that. Listening, you want it to sound resonant. If you're hearing dullness, that could indicate some ascites or possible enlarged organs. And then going to check and use percussion to estimate the borders of the liver. So starting lower, going up, listening until you get to dullness, so right in here, right beneath the ribs, and then you're starting up in the intercostal space up here, going down until you hear dullness and get to the top part of the liver. And then you want to listen for, or percuss for the spleen, so we're going down the mid-axillary line, so right down here, to the 10th intercostal, finding the 10th intercostal space, and percussing there, making sure that you're not hearing dullness. And then listening for gastric at the left lower rib. You should be hearing tympany there. So then, starting with palpation, we're doing light palpation in all four quadrants. You can go with both hands, just slightly palpate about 1 centimeter in depth, right lower, left lower. And then checking, of course, for any pain, tenderness, muscle tone, masses, and bulges. And they're doing deep palpation, 5 to 8 centimeters in depth in all four quadrants. Same thing. Checking for the same stuff, just checking for any deeper masses. And then for liver palpation, you can go with the inspiration technique. So you do deep palpation where you felt it, and then you have them take a deep inhalation and check if there's any tenderness with that. And if you're having trouble finding the liver or palpating it, you can use the hook method. So you hook the fingers at the costal border, right in here, and then you should, hopefully you can do it gently and palpate the liver using that method. And then palpating the spleen, so go ahead, I'm going to get my left hand under your back and kind of bring it up at the costovertebral angle, and then you're palpating with your right hand, and you shouldn't be able to feel the spleen. If you do, that means that it's likely enlarged and that there's pathology going on. So then check the inguinal nodes. We'll do this right in here, palpating, checking if the lymph nodes and femoral pulses at the same time, and did CBA tenderness on the lung exam. So now just checking Murphy sign, which is normally positive if there's presence of cholecystitis. So we're going right upper quadrant and palpating and having them breathe, take a deep breath in and letting go and checking if they have any tenderness during that. So then you can check for rebound tenderness, especially this is a good one to check for appendicitis if it's going on. So you're going right lower quadrant and rebound tenderness, you just ask them, is it more tender when you're actually palpating or when you release, which would be the rebound tenderness. Now for the obturator muscle test, so have them bend the hip and knee at 90 degrees, and then you just rotate it laterally immediately to see if they're having any tenderness in that obturator muscle region right in here, which can be an indication of peritoneal irritation. And then the iliopsoas muscle test, you just have them flex their hip and see if they're having any tenderness in there. And then the McBurney sign. So McBurney's point is that the bony prominence of the hip, and then finding the umbilicus, and then going 1/3 of the way from the hip, and then that is likely the region of the appendix, and so you can check to see if they have any tenderness in there from palpation. And then for the heel or Markle sign, you'd have the patient stand up and then have them go on their tippy toes so their heels are off the ground, and then just drop to their heel. And if they're having any pain when they do that, then that can be a sign of peritoneal irritation as well.